Sally is brushing up on her disease investigator skills. She is reviewing her notes from her first few days of trainings with her supervisor, Evelyn. She is still learning which communicable diseases are reportable and what that means. She already learned about the regulations that give authority to public health to investigate cases of diseases, but she is interested in learning more about the various reportable diseases. Her supervisor told her to go to the state health department's website where she can learn more about immediately reportable and reportable diseases. The state has good resources that she can access and learn more about reporting. Sally goes to the state website and finds a cool list of reportable diseases.
This list is long. Wow, who knew that the state required healthcare providers, labs, and others to report on these diseases, and all in different time frames?
Sally continues to review the website. She sees that those required to report should report to the local health department where the patient resides. If patient residence is unknown, report to the local health department where the provider is located. For more information about local health departments, go to the web address shown on the screen. Per regulation, local health departments must be available 24/7 to receive reports of immediately notifiable diseases by telephone and through monitoring CDRSS and initiate investigation. Local health departments must be certain that reporting entities in their jurisdiction have their contact information during and after business hours and a procedure for reporting.
I wonder how my local health department handles after-hours calls. It looks like the main difference between a reportable disease and an immediately reportable disease is whether there needs to be an immediate public health response, such as providing medication, a vaccine to prevent illness, or breaking the chain of infection. Neat. I never thought about classifying diseases that way. It makes perfect sense. In cases of immediately reportable diseases and other emergencies, if the local health department cannot be reached, the New Jersey Department of Health may be reached during business hours at 609-826-5964 or after hours at 609-392-2020. This includes weekends and holidays.
Sally continues to read about how local health departments must maintain after-hours contact information within the Red Book. The Red Book ensures that state and local health departments can contact each other after hours.
Gosh, Evelyn didn't say anything about our department having 24/7 coverage. I wonder if I'm expected to be on call. Maybe once I'm totally trained. I'm going to ask Evelyn about the Red Book and 24/7 reporting.
The regulations define when something is reported to the local health department. Understanding that local health departments deal with competing priorities, the Communicable Disease Service developed a guidance document to assist with further prioritizing public health investigation and response. The Disease Prioritization for Investigation and Response guidance document was distributed in a links message in 2018. The guidance document is meant to be a comprehensive tool beyond what is listed in the regs. A copy of this document may be requested from the Communicable Disease Service. The Disease Prioritization document does not define the time frame of when a disease is reported to the local health department or the state health department, but rather the time frame by which the health department should be conducting and completing communicable disease investigations. The investigations should include critical details such as demographics, signs, symptoms, clinical status, lab information, patient location, and risk factors. If details cannot be obtained, the local health department must document the reason for the delay in CDRSS and when they anticipate the details will be available. Investigation steps may vary by disease, but typically involve collecting information from the patient's healthcare provider and/or hospital infection preventionist. An investigator will also need to interview the patient or the patient's family member. Sometimes they will need to identify and follow up with people who may have been in contact with the sick person. Several diseases also have specific data collection tools. Some of these tools are used to simply get initial information about the case, while others are more extensive and assist in gathering specific details about the person who is sick. All information collected about the case and investigation should be included in CDRSS.
Disease investigators should be aware that some case investigations require CDC case report forms to be completed and submitted to the Communicable Disease Service. They should also be aware that in CDRSS, there are disease-specific questionnaires, or DSQs, that are intended for completion by the disease investigator. Investigators can locate DSQs in the menu bar in CDRSS. The DSQ must be added to the case by the disease investigator. It often contains specific information and should be completed for the case of disease being investigated. Contact tracing forms are also helpful tools. Identifying and following up with exposed contacts help public health track individuals exposed to a disease who may or may not yet be ill. Tracking these individuals can help public health to identify more cases and also warn those not yet ill to monitor their health for signs of illness. Often these forms don't correspond with a specific CDRSS case, but should be completed and submitted to the Communicable Disease Service. Once the investigation is complete, cases should be classified in CDRSS per the case definition and closed out by the disease investigator. Case definitions can be found in CDRSS by clicking on the disease name within a CDRSS case or at the NJDOH website in our A to Z disease listing shown on the screen.
Wow, it is good to know that there are many resources and tools to help with disease investigation. I need to add this to my list to discuss with Evelyn tomorrow. This list is getting longer, but having the answers to my questions will be great. I'm looking forward to meeting with Evelyn to discuss this further.